Hi everyone, Janine here, and I'm here to answer a few questions today. One comes from Harriett York. She asked, what can I do to reduce the achy feelings in my lower abdomen? I'm 8 months pregnant and it's becoming a bother. Well, Harriet, there's a couple things you could do. At nighttime, you might want to purchase a body pillow or a support pillow. They sell pregnancy ones, or you can just do a regular body pillow. Put one underneath your belly, and like on your side, underneath your belly, and then one between your legs, or like another pillow between your legs, and then another one kind of supporting your lower back that you can kind of lean on to if you need to. Most people find that pretty comfortable to sleep, and then that reduces that hanging pressure kind of feeling, at least when you're sleeping, because you do want, your baby supported off of you a little bit while you sleep, so that during the day you're not as uncomfortable. During the day, a couple things you could do. It depends on what your day-to-day activities kind of are. If you are a person who is up walking around a lot, personally, I worked like 14-hour shifts a lot, and I needed a belly band. So once you get that belly band on, it goes right underneath your lower abdomen, and it kind of lifts that baby up, and almost immediately you'll feel a difference. Because that achy stuff you're feeling in the front, you may also start to get some lower back pain too. So Tylenol, if you need some Tylenol too. But a lot of that you can do a little bit, but sometimes just towards the end, it's just the end of pregnancy kind of yucky feeling where you just feel huge and you just want to be done. So the last month or two can be very bothersome. Another question we got is from Michelle. She asked, is working in dirty environments like recycling bad? I'm exposed to all kinds of materials and get cuts and smelly, nasty stuff. But the point is it bad for my baby? I'm 3 months. Well, Michelle, there's a couple things. If you are in like a polluted environment, it's not terrible, but research has shown that if you come in contact with high levels of certain pollutants like car exhaust, you might have a slightly more premature baby or a small weight baby. So, and it also shows that air pollutants may lower the child's IQ. If you're stuck in this kind of environment, you might want to talk to your healthcare provider about different options that you can do. Talk to your employer about how to protect yourself against some of these pollutants that you are exposed to. The cuts and stuff, I would just make sure you definitely have what's called a Tdap vaccine. That's going to cover you for tetanus, diphtheria, and pertussis. Tetanus is an awful disease. Everybody, they stepped on a rusty nail. That's the shot you get. It protects you from tetanus. You really should not be in an environment where you're getting cuts and things on your hands. That's what I'm kind of understanding from your question. But another thing you might want to avoid is just other, certain chemicals in your house. You don't want to clean with ammonia and bleach and stuff. These chemicals can get in your lungs, and all you want to do is provide your baby some pure oxygen. And if you can't even get your own oxygen pure, how are you going to give it to your baby? That placenta that's attached to your baby, that's what's giving your baby the oxygen all the time. So if you're not oxygenating well, your baby's not going to oxygenate well. So try to avoid situations on which you are definitely exposed to those kind of chemicals, because in the long run, you don't want your baby to have a low IQ because you need it to work. Maybe look for a different kind of job, a safer kind of job. And your employer should be able to help you out. Maybe there is some desk work or office work that you can do for the same company. Them knowing you're pregnant, they should hopefully abide by that kind of stuff. There is no law out there, but there should be, I think, because you are trying to oxygenate a human being. So Michelle and Harriet, I hope that kind of answered your questions a little bit. We covered kind of the first trimester, which is up to 3 months, and then that last trimester. So there's stuff in the middle, but a couple things for both of you guys. For Harriet, don't do too much work. Stay off your feet as much as you can. Elevate your feet as much as you can. Avoid kind of varicose veins, things like that, with that pressure. And Michelle, avoid definitely like changing cat litter. You don't want to be around that kind of chemical. Lead exposure, mercury exposures, things like that. Pesticides and certain chemicals, and things like air pollutants and stuff. Remember that anything that can affect your baby, or it can affect you, is going to affect your baby. So that's why, you know, you're not going to do drugs and alcohol during your pregnancy, because that's going to affect your baby. So things like that. If you think it's bad for you, it's probably bad for your baby.